morning. How are you?
Good. How are you?
I'm great. My name is Chidema. I'm going to be your student nurse for today. Can I get your name and date of birth?
Paula Cunningham, 9496.
Okay, great. Today we're actually going to be doing a head-to-toe assessment. It's just going to give you a general overview of how your body systems are working. So I'm going to start by washing my hands. And I'm going to close the curtains here to provide you with some privacy. And the exam is actually going to start with your head. So I'm going to start by looking at your head. It is normal, cephalic, and erect. And now I'm going to touch your head.
Okay.
Let me know if you feel any pain, any tenderness.
No.
Okay, great. No pain or tenderness noted. No masses or lesions felt. Now I'm just going to have you just follow my directions. Squeeze your forehead. Okay. Puff your cheeks out. All right, now clench your teeth. Okay, now smile and squeeze your eyes really tight. Okay, cranial nerves 5 and 7 are intact. All movements are symmetrical and appropriate. Now I'm just going to have you close your eyes. I'm going to put something in your hand for you to taste, and you tell me what you're tasting.
Crunchy Cheeto?
Yes, that's correct. So cranial nerve 7 is intact. You can open your eyes now. So now I'm going to touch your face again. I'm going to be feeling starting with your frontal sinus. Tell me if you feel any pain or tenderness.
No.
Okay, no pain or tenderness noted. And now your maxillary. Any pain or tenderness?
No.
Okay, wonderful. No pain or tenderness noted. Now we're going to move on to your eyes. We're going to start by just looking at your eyes. The eyelids are well approximated. Sclera is white. The conjunctiva is pink. Next, I'm going to take my pen light here, and before I do that, we're actually going to do something called the positions test. I just want you to follow my finger with your eyes. Don't turn your head. Ready?
Mm-hmm.
Okay. Okay, all eye movements were parallel with my finger. Cranial nerves 3, 4, and 6 are intact. Now I'm actually going to look in your eye with the pen light. Okay. Alright, pupils constrict bilaterally in the presence of light. Pupils are equal, round, and reactive to light and accommodation. So cranial nerves 2 and 3 are intact. Next, I'm going to take my ophthalmoscope and just look into your eyes, looking at your pupil again. Okay, red reflex is present bilaterally. So next we're going to move on to your ears. Just looking at your ears, they are symmetrical, and they are also, the color is consistent with the facial color, so that's good. I'm going to look at them, touch them. Alright, no masses or lesions noted. Do you feel any pain or tenderness?
No.
Okay, no pain or tenderness. I'm going to do something called the whisper test. I'm just going to have you stand up really quickly, and I'm going to stand about 2 feet behind you. Hold one earlobe closed, and I'm going to whisper a combination of letters and numbers. I just want you to say it out loud, whatever I whisper.
Okay.
All right, ready?
Mm-hmm. 3LW.
Okay, wonderful.
253.
Okay, great. You can have a seat. All right, cranial nerve 8 is intact. Now I'm going to take this tuning fork, and I'm just going to hit it. I'm going to place it over your head and hit it. Let me know if you hear the sound. Let me know if you hear the sound equally in both ears, or like more in one ear or the other.
Okay.
Okay. And
both ears.
Okay, great. Now I'm going to take the otoscope, and I'm actually going to look inside your ear at your tympanic membrane. I'm just going to hold it up and back. Okay. And the other one. Okay. Tympanic membrane is a pearly gray color. The cone of light is present bilaterally. In the left ear, it's at 7 o'clock. In the right ear, it's at 5 o'clock. Um, okay, now we're going to go on to your nose and mouth. Just looking at the nose, it's midline. Septum does not look deviated. And I'm just going to hold one nostril shut while you breathe in with the other. Okay. Do you feel any trouble breathing?
No.
Okay, no obstructions noted. Now I'm just going to have you close your eyes and I'm going to hold something under your nose and you tell me what you're smelling.
Okay. An alcohol wipe?
That's correct. Cranial nerve 1 is intact. Now I'm going to take this tongue depressor and just look around your mouth.
Here.
Alright, open your mouth. Alright, there's the frenulum. Put your tongue down. Buccal mucosa, hard palate, soft palate, uvula, tonsils are 2+. Say ah. Okay, uvula and soft palate move up midline. I'm just going to touch the back of your throat and test your gag reflex. Okay, gag reflex is present. Alright, the oral mucosas look pink and moist. Now I'm going to look at your teeth. Alright, looks like this patient has good dentition, no dental caries noted, and all teeth are present. Cranial nerves 9 and 10 are intact as well. Alright, now repeat after me. Just say light, tight, dynamite.
Light, tight, dynamite.
Okay, speech is clear. Speech is clear. Cranial nerve 12 is intact. Now we're going to move on to the neck. Just feeling the neck here. The trachea is midline. Feel any pain or tenderness?
No.
Okay, great. I'm going to feel your lymph nodes. Sorry, I'm going to feel on your lymph nodes. Starting with the preauricular, right, postauricular, occipital, submental, submandibular, superficial cervical, deep cervical, and the supraclavicular. Did you feel any pain or tenderness?
No.
Okay, no pain, tenderness, or swelling noted. Now I'm going to feel your carotid artery. Okay, pulse is an even, steady tempo. It's about a 2+, so that is normal. Now I'm actually going to listen to your carotid. So I'm just going to have you take a deep breath in, exhale, and hold it for a couple seconds.
Okay.
In. Okay. Deep breath in. Exhale. Hold. Okay. Pulse is an even, steady tempo as well. No bruits were noted. So now we're going to go on to the skin. Skin complexion and color is even and smooth, consistent with the genetic background. I'm going to go ahead and touch your skin. The temperature is warm bilaterally, and I'm going to pinch you right here. Okay, skin turgor is good. Patient does not appear to be dehydrated. Now we're going to move on to your respiratory cardiac. I'm going to start by having you turn around for me really quickly. Thank you.
Mm-hmm.
So I'm going to put my hands like this and just have you take a deep breath in and out. Okay, chest expansion is equal bilateral. AP ratio is less than transverse. Now I'm going to go ahead and listen to your lung sounds. I'm just going to have you take a deep breath in and out through your mouth. And go. Again. Again. One more time. Alright, you can turn back around. Now I'm going to listen to your lung sounds in the front. Deep breath. Again. Again. One more time. Okay, wonderful. Now I'm going to listen to your heart sounds, starting with the aortic, pulmonic, tricuspid, mitral. Okay, wonderful. S1 and S2 present. No extra heart sounds were noted. Now I'm just going to feel your pulses, starting with your radial pulse. Okay. All right, brachial. Now your, thank you, dorsalis pedis. And posterior tibialis. Okay, all pulses are present and there are 2+. You can put your legs back down. There are 2+, which is normal. Now I'm just going to test your capillary refill. So I'm just going to pitch your finger here. And your toe. Okay, blood returns in 1 to 2 seconds, so capillary refill is good. Now I'm just going to have you lay on your back so I can look at your abdomen. Okay, abdomen contour is flat. Now I'm going to listen to your abdomen first for your bowel sounds. Starting in the lower right quadrant, left, upper. Okay, normal bowel sounds are present. Now I'm just going to percuss your bowel, starting in the right lower. Okay, no dullness or hyperresonance noted. And now I'm going to go ahead and touch your abdomen lightly. Okay, and now a deep touch. Did you feel any pain or tenderness?
No.
Okay. No pain or tenderness noted. No muscle rigidity. And no lesions or masses present as well. Okay, you can sit back up. Next we're going to test your musculoskeletal system by doing some range of motion exercises, starting with the neck. So I just want you to touch your chin to your chest. Alright, up and now back. Okay, great. Now your ear to your shoulder. The other one. Okay, great. Now turn to this side and the other. Do you feel any pain or tenderness?
No.
Any limitation?
No.
Okay, great. So now I just want you to stand up really quickly. Right? And try and move your arms up like this. Okay, great. Muscle strength is equal bilaterally. Now I just want you to go ahead and move your arms up like this. Great. Now try and touch above your head, behind your neck. Now reach back and grab your arms. Okay, do you feel any pain, tenderness?
No.
Okay, great. Next we're going to do your spine. So try and touch your toes as far as you can. Wonderful. You can come back up. Now to the side. Other side. Now turn. And to the other side. Okay, any pain, tenderness?
No.
Okay, great. So you can sit back down. Now we're going to go ahead and do your legs. Lay down for me. Okay, now I just want you to lift your legs straight up. Okay, muscle strength equal bilaterally. Now lift one leg straight up. Okay, the other. Now one of your knees to your chest. And then the other. Alright, now kick your leg out to the side. Yes, and then the other. Great. Now I just want you to bend your knee and turn your hip in. Yes. Okay, and your other leg. Alright, any pain or tenderness noted?
No.
Okay, great. No pain or tenderness, no limitations in range of motion. You can come back up. Okay, now we're just going to do our last part of the test. It's a neurological assessment, so I just want you to actually stand up for me. And I'm going to have you walk in a straight line, one foot in front of the other.
Okay.
Okay, great. You can stop. No swaying or deviations from the midline, so that's good. Now I just want you to hop in place. Okay, that's enough. Movement smooth. No difficulty with that movement. Now I'm going to have you touch your finger to your nose. Now touch my finger. Back. Okay, my finger. Your nose. My finger. Your nose. My finger. Your nose. Okay, all movements were smooth and appropriate. Now I'm going to have you close your eyes. And I'm just going to touch something to your face. You just say now when you feel it.
No. 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 No.
Okay, wonderful. Light touch was appropriately detected. Also, one more thing. I just want you to shrug up against my hands. Okay, great. Cranial nerve 11 is intact. Muscle strength is equal bilaterally. Close your eyes one more time. I'm going to place something in your hand, and you just let me know what it is you think you're feeling.
A coin.
Okay, great. Perfect. Patient correctly identified item in her hand. So you can go ahead and have a seat. That is actually the end of our assessment, so thank you so much.
Thank you.
Mm-hmm.